If you want, you can remove the bowl for easier cleaning. Press the clip downwards, rotate the bowl a little bit and then lift it up. And when you want to put it back, put in place and rotate. If you don't use the bowl or you use it very seldom, we recommend that you consider removing the whole bowl assembly completely for infection control reasons. And you can ask your technician to do that. Maintenance menu includes instrument flushing programs. Short flushing between the patients and long flushing in the beginning and at the end of the working day. You can also see the timestamps of previous flushing programs. When you place instruments into the instrument flushing holder, remove the syringe cover. The syringe you must place into its dedicated opening. The other instruments you can freely place into other openings. Make sure that the instrument arms are bent when you start the program. If they are not bent, they won't be flushed. In Planmeca Compact i5 unit, there's an integrated suction tube cleaning system. So at the end of the working day, you just plug the suction tubes here and start the program. The unique system works so that the suction tubes are filled completely, so that there's enough contact time for the disinfectant to act. If you have long suction tubes, you should place them on the floor to make sure that they are filled completely. The system is quiet, and it's also great that you don't have to wait next to the unit for the program to end.